Hospital emergency procedures are in question after a healthcare worker treating that recently deceased Ebola patient in Dallas. She apparently contracted the disease. Meg Tirrell joins us now from Dallas with more. Hello again, Meg.
Good morning, Joe. That's right. That healthcare worker was caring for Thomas Eric Duncan, the patient who is being treated here at Texas Health Presbyterian. She is the first confirmed case of transmission of Ebola here in the United States. Now, we know as of yesterday her condition was stable. One contact of hers is being proactively monitored in isolation. And now, of course, all of the healthcare providers who cared for Thomas Eric Duncan are being monitored. The CDC saying if one person was exposed, others could have been as well.
Unfortunately, it is possible in the coming days that we will see additional cases of Ebola. This is because the healthcare workers who cared for this individual may have had a breach of the same nature of the individual who appears now to have a preliminary positive test.
Now, they're still gathering official numbers of how many people they're monitoring, but it could be about 18. CDC's Dr. Tom Frieden say they don't know how she was exposed, but they're looking at a couple things particularly closely. When the patient was administered kidney dialysis and when he was intubated with respiratory intubation. They're also looking at procedures for taking off the personal protective equipment. Now, they're also making recommendations for stepping up training of healthcare people at hospitals, saying that in Ebola care, they should keep the number of people treating patients to a minimum, keep the number of procedures to what's absolutely necessary, and designated one person in charge of infection control for the entire healthcare system while treating an Ebola patient.
When they're essentially blaming the workers for not following some procedure the right way, that has to have implications with those people who are on the front lines, the healthcare workers who are responsible for dealing with these patients when they come in.
Certainly, I think we have to be careful that I'm not sure they're blaming the healthcare workers, but saying something could have happened where maybe procedures weren't followed as closely, or just people weren't as careful as maybe they needed to be. Maybe there wasn't a buddy system. All of those things need to be examined. I don't think any blame is being put on anybody in particular, other than saying that hospitals need to be a lot better prepared here. And we have been hearing from the nurses union saying that hospitals have not been educating them as much as they would like, and they need to be on Ebola procedures. Huge percentages of those nurses who responded to a survey saying that they don't have any policies in place at the hospitals in terms of treating Ebola patients. So there's a lot of questions about whether regular hospitals who may be getting people coming to their emergency departments can deal with this. And we've got 4 biocontainment unit ready hospitals in the United States, but it's not those hospitals who are going to be intercepting these patients initially. So that's the concern.